Perfect. All right.
Right, everybody can see that?
I can see it. Can everybody hear me?
Mhm.
Oh, bummer, it's choppy. When it's not, when it's on the regular screen, it's nice and smooth. Okay, welcome everybody to Ending the Stigma Microdosing 101. I'm very excited to be here and to have you here to spread the knowledge and information on microdosing psychedelics. Before we get started, we do not sell illegal substances. And this will be posted to YouTube if you're watching on YouTube, and if you're watching later on in July or after, we have rebranded. So we are no longer Trusted Canna Nurse. We are now the new brand, but we're still using this webinar. Those are my two disclaimers, and everybody's going to hold their questions until the end, and let's go. Okay, here's just a little bit about us, about Trusted Canna Nurse. So we are a team of medical professionals, and we provide cannabis guidance and education, as well as tolerance break programs. We also offer microdosing programs and psychedelic facilitation, and then our crafted hemp products. Just a little bit about my backstory. I was a registered nurse. I still am an RN, and I was in the Western system. And as a hospice nurse, I saw the therapeutic magic of cannabis in my hospice patients while working at the bedside. And I also saw the extreme challenges of navigating this really confusing world of cannabis and CBD. So I decided to jump in the deep end, learn everything I could at that time about cannabis and CBD. And I went to graduate school. I now have a master's degree in medical cannabis therapeutics, and I started this business almost exactly 3 years ago. And then along the way, what I was encountering is that all of my patients who have chronic illness, many of their chronic illness symptoms, uh, are derived from some sort of history of chronic stress or trauma. And while cannabis is a fantastic tool to help with the symptoms, the pain, the anxiety, the sleep, people weren't really getting resolution around that trauma or their relationship to it. So that's when I started learning about psychedelics. I brought Ariane on board because she has special training in psychedelic facilitation, and we started offering microdosing programs 2 years ago, and we have changed many, many lives, and we are a growing team. We recently added Lacey, who is on this call, who will be helping with our microdosing programs as well. And then in the meantime, we also crafted a line of hemp products, and that's not what this webinar is about. So that's just a little bit about us. Next, please. Okay, let's get into what psilocybin is. Psilocybin is just a mushroom. It's a genus of mushroom. There are over 180 different species or varieties. There's probably more now because I'm sure there's a lot of crossbreeding going on. When we consume mushrooms, we consume them like whole, and we're measuring them by the weight of it. So if we're talking about 50 milligrams of psilocybin mushrooms, we're taking a piece of this dry mushroom and putting it on a scale and measuring 50 milligrams or 5 grams or whatever it is. When you're looking at clinical studies, and this is just an FYI, they might say something like 25 milligrams of psilocybin. They're actually extracting the psilocybin and measuring it like that. So 25 like milligrams, depending on how much it, on the potency of it, um, you know, will determine how much mushrooms. So, for example, what's the clinic up in Oregon? What's Heather's clinic? So the psilocybin clinic up in Oregon, they do it by that dosing. So 50 milligrams is like their highest dose, and that's equivalent to about 7 grams of raw mushrooms. So just so you know, there is a difference between like the mushrooms that we use that we're measuring, just the whole thing, versus the actual psilocybin. It's kind of like cannabis and how cannabis and THC percentage measures out. Next, please. All right, historical context in the US. This is so important in how we consume mushrooms. So historically, like many, many plant medicines, it was used by indigenous peoples of Mexico, Australia, all over the world. In 1955, a Chase banker and mycologist, Gordon Wasson, had some curiosities around mushrooms. So he traveled to Mexico, excuse me, to this small village where Maria Sabina lived, and she was hosting, locally. She was one of the healers and was hosting mushroom healing ceremonies. So she didn't perform. So he had a mushroom experience under Maria Sabina. And then he came back to the US, and against Maria Sabina's wishes, he printed out his story and his experience in Life magazine. And that went, the equivalent of viral, that we have around the country. And then from there, people all over the country went down to this small village in Mexico to have the same mushroom experience. And it was, they kind of exploited this culture and this sacred mushroom and sacred ceremony. And Maria Sabina didn't want that, and her culture, her community didn't want that. And her community actually, they burned her house down because of what had happened. And then she was kind of exiled from her community. Also, the Gordon Wasson brought the mushrooms back, and he sent a sample to Albert Hofmann, who is the scientist who isolated LSD in the 30s and 40s. And then he was able to isolate psilocin and psilocybin from the mushroom to figure out that that was the psychoactive component. Then in the 60s, we saw trials on cancer patients, treating their existential crisis, and many other research trials as well. And then it became Schedule 1 in 1970. And then here we are, it is still Schedule 1. Next, please. Okay, here is psilocybin legality, much like cannabis that is Schedule 1 on the federal level. Some states and municipalities are coming online and either decriminalizing it or legalizing it for therapeutic use. And what it means when it's decriminalized, it means that they're just kind of the law enforcement is basically going to, kind of turn see nothing, say nothing, whatever it is. So they're going to turn a blind eye. They're not going to penalize people for having mushrooms. Does not mean that it's legal to sell or, legal to distribute, but you're not going to get punished. Legalized means that it's regulated much like cannabis is. There's a regulatory framework in place for, for growing and distributing and selling. And using. Each state is different, and hopefully we will see more and more as time goes on. All right, LSD. Let's talk about LSD and what it is. LSD is lysergic acid diethylamide. This was originally found and extracted from ergot, which is a fungus that grows on rye. And this is also considered a classic psychedelic because it acts on the same receptors as psilocybin. This was first discovered by Albert Hofmann in 1938. Bicycle Day was in 1943. That is the first known documented LSD journey that Albert Hofmann took. He took 250 micrograms and then took a bike ride home and had the trip of his life on this bike ride. Unlike psilocybin, which is dosed in milligrams and grams, LSD is extremely potent and dosed in micrograms. So we are moving the decimal point 3 more points to the left and dosing that out. And this is something that is not, there's not really a scale available to consumers to weigh out microdoses like this in the microgram range. So this is a microdose of LSD is considered about 5 to 10 micrograms. 20 milligrams, you're kind of getting more to the mid-range. And then a macrodose is considered 100 micrograms plus. And what it does is it alters our sensory input, it alters our sense of time and self-awareness. And then in the 60s, it was being studied for OCD, alcoholism, anxiety, depression, the existential end of life. And then it also was made Schedule 1 in 1970 because it was part of the counterculture movement. Nixon was having trouble getting people signed up to go to the war, and he blamed it on LSD, so then made LSD Schedule 1. It had nothing to do with its safety. All right, let's talk about how they work in the body. I kind of have these two lumped in together because there is a lot of overlap in how they work. When we consume psilocybin, it will convert to psilocin. Psilocin, however you say it. It converts to psilocin in the liver, and then that is the active chemical. And what that does is it binds to a bunch of receptors, but the 5-HT2A is the primary receptor that it binds to. And depending on the dose that we take, the effects can be subperceptual, meaning that maybe we feel something, maybe we don't feel anything, to if we're taking a number of grams and taking a macro dose, that we have a fully altered perception, fully altered mood, fully altered cognition. That's when we're seeing the visuals and the colors inside our mind. So these receptors are also responsible for smooth muscle contractility. That means the contractions of the smooth muscle. They are responsible for memory and learning and oxytocin release. And just for frame of reference, Haldol and Trazodone, those two medications block they block these receptors. So just so you know, like those medications are antipsychotic medications. And people who are on those medications, we'll talk about this a little bit later, but people on those medications often need higher doses, and it's because of that action on this specific serotonin receptor. Psilocin also binds to the TKRB receptor 1,000 times stronger than antidepressants. And this is oftentimes why we see faster, much faster effects with psilocybin than we do with antidepressants because of that TKRB receptor. And that receptor, the molecule that binds to that receptor is responsible for enhancing neuronal connection and neuroplasticity. And neuroplasticity is our ability to form new connections in our brain. Next, please. Okay, LSD versus psilocybin. Let's just compare these two. Both are classic psychedelics. Both can be microdosed and macrodosed, and both are extremely safe medicines. But let's go through the differences between them. So LSD is synthetic, although it was found, in a fungus that grows on rye. How we use it today is something that is synthesized in a lab, whereas psilocybin is, of course, natural and organic. The effects that they have. LSD can be very energizing and stimulating, and that energy can last 8 to 14 hours, depending on how much you took. So if people are microdosing LSD and want to get a good night's sleep, then, we recommend taking it earlier in the day if they are choosing to do that. Whereas psilocybin is definitely more of a grounding type energy. People often feel kind of heavy, like almost like they have a weighted blanket sometimes. And a larger dose will last around 4 to 6 hours. Microdoses, depending on the dose, can last around that time also. LSD is known to be it's more analytical, problem solving, like mind expanding, whereas psilocybin is kind of softer, flowing, organic, and heart opening. And, you know, you could kind of like one is slightly more masculine energy and one is slightly more feminine energy, if you want to look at it like that. Both are incredible medicines. ChatGPT gave me these things last night. LSD is like being handed the keys to a multi-dimensional spaceship and being told, "Good luck, Commander." Whereas psilocybin is like being swallowed by Mother Earth, who whispers, "Shh, let me show you." And these, of course, like are in the larger doses. But that's the comparison between the two. Now, how about the safety of them? You know, we were told that psilocybin and LSD cause psychosis and cause people to jump out of windows, and a lot of that was so much propaganda at the time. So I like showing the safety of these medicines on this graph. So up and down, we have the dependence or the addiction potential. And then left to right is the lethality of it. So the drugs in the upper right corner, these are the ones that carry the highest risk for addiction and lethal overdose. And the ones in the lower left carry the lowest risk, almost zero risk of addiction and lethal overdose. So people cannot consume, they cannot, overdose on LSD and psilocybin in a way that will kill them. Yes, they could have a really intense journey, but eventually will come down from it. And then they're not becoming addicted to it. You don't come out of a psilocybin journey and say, "I want to do that every single weekend." All right. So, in fact, they're anti-addictive, helping people with their issues with other substances. And just for reference on other substances that are seen at a gas station, caffeine, nicotine, and alcohol are all more dangerous, yet those are legal. LSD and psilocybin remain Schedule 1. Schedule 1 means high potential for abuse and no accepted medical use. I have other psychedelics on here as well, ketamine, mescaline, and MDMA, just to show us where they are in reference to other substances that are legal. Next, please. All right, how can psychedelics help us? We've seen psychedelics and research supports psychedelics for treatment of all of these things here: OCD, anxiety, depression, eating disorders, PTSD, cluster headaches, substance use, physical pain, symptoms of autism, plus many, many more. The research that was coming out before it was made illegal in the 60s and 70s was phenomenal research. It's really cool to go back and look at, the stuff that has not been stripped away, to look at those studies. A lot of these issues stem from a history of trauma for a lot of people, either one big event or a series of events. And so what this allows us to do is kind of go back deep inside our mind and reframe our relationship with that trauma, helping to bring resolution around it and come out on the other side having a better, a better outcome, and having depression symptoms. I don't want to say fully resolved, that they have resolved for a lot of people, and anxiety symptoms and OCD. So they can help us with a lot of things. In both the macrodose and microdose space, they're kind of different things. We're going to go through those differences. Next, please. All right, there are a ton of studies on psychedelics. Here's just one that I really like to show you guys, to show the difference between how they measured psilocybin and Lexapro in two different groups. And what they did, I can't remember how many people it was, maybe 20 people. One group got the standard Lexapro dosing, whatever the standard is. And then the other group got 25 milligrams of psilocybin 3 weeks apart in this 6-week period. And again, remember that dosing, that 25 milligrams, that's probably 3.5 to 4 grams-ish. So these are not microdoses, these are larger doses, larger journeys. And what they found, here we have on the left, we have the depression scores. The salmon color is the psilocybin group. The blue is the Lexapro group. So after 2 weeks, see how much of a difference between the psilocybin and the Lexapro groups are. And then the psilocybin group continues to go down through the 6-week period. And then the Lexapro group kind of levels out and even goes up a little bit after the 6-week period. So this is comparing those two. Then we move over to the right, and we're just going to focus on the graph, the first graph here, the brain modularity. And you see that it went down in the psilocybin group, the salmon colored group. And what brain modularity is, or brain network modularity, is how our brain is divided into different sections. And this is oftentimes how we can get stuck in our ways. And we have these, consistent thought patterns that are a very certain way. And it's because our brain is divided out into these little sections. And what it means that it decreased the modularity was it means that there was crosstalk between the different sections of the brain, that there was more global connectedness. So people's minds were literally expanding to be able to talk to different sections of the brain. So then people can get out of those detrimental thought loops and that brain chatter and those thought patterns. And that's exactly what this shows here. Okay. Um, and then that is it for this study. I could go much deeper, but I want to keep it simple for you guys. And with that, I'm going to hand it over to Ariane. Take it away.
Hello, hello.
Oh,
Uh,
Ariane, do you want to share your experience and training a little bit about yourself?
yeah, sure, I can. My name's Ariane. I'm a nurse. I've been a nurse for almost 2 decades. And I've been doing this work for the past 4 years. Um, my own personal journey has really got started on it. I have a history of alcoholism, as well as using antidepressants collectively for about 15 years. And I was able to successfully come off of my antidepressants 5 years ago with the help of therapy and psychedelics and lifestyle changes. And I've been off of them since. So I started supporting people and educating around this because it was so transformational for me about 4 years ago. And I started doing additional training. I did training with Sound Mind in Philadelphia on ketamine, MDMA, and psilocybin facilitation. I did further stuff with ketamine. I did integration training as well. And I did training around psychedelic cannabis too, and ways to support people in that. And I've been working with Megan for about 2 years now, and it's been amazing. I've supported hundreds of people over the past several years, and it's a great honor to do this work and share this with y'all today. Um, Megan's talked a lot about, the substance and the histories and stuff like that. And a lot of the research really is looking at macrodose experiences. However, there is some stuff that's starting to come up around microdoses and the effects that people receive from it. So a microdose is small, subperceptual dose. You take it a few days a week for a few weeks. It's not something that has to be done every day, nor is it something that needs to necessarily be done long term. But overall, people feel more clarity. They feel grounded. Some people just report that they're able to navigate stress better, or they feel less hypervigilant, that their mood is starting to elevate, and that they just feel a lot more motivated to do things. And you really start with microdosing seeing changes over time. It's kind of what I tell people. It's like the thing, it's like if you're like going to the gym and you're like working out, and you're not going to see necessarily results immediately, but you are going to see some shifts and changes over time. And perhaps maybe the people around you will actually start seeing the shifts in you before you actually see it yourself. So we've had family members who have commented, or our clients have told us that family members are like, you're different. Like, what's going on? Where a macro dose is kind of like, one of those big things that happen. Like if someone was to get like a really big diagnosis, and then all of a sudden everything in life has to change afterwards. That's kind of what a macro dose is you can just have a really big experience with a lot of new insight come through, and a lot of changes can happen quickly on the other side. Where microdosing is a little bit slower, it's a little bit easeful. Another analogy would be thinking like if you were at a faucet and you turn the faucet on to like a drip versus like fully engaging and just like a whole lot coming out at once. Um, The macro dose is done in one session for treatment-resistant depression. When they did research around that, one of the research studies showed that it was like 2 to 6 doses over time in combination with therapy is really what helped get people resolved with their treatment-resistant depression. It is definitely a felt experience where you're going to feel more stimulation, whether that be physical stimulation, sensitivity to light, sound, things like that. Also possibly have some visuals, and the visuals are not kind of what like the propaganda has shown with like the pink elephant in the room or anything like that. Um, the visuals are can be like geometric. You close your eyes or something like that. Perhaps things look a little wavy outside of you. Macro doses are a great place to kind of go in and ask specific questions around different periods in life so that you can get different insights on things and really make those shifts that you need to or desire to really. It is more of a mystical experience where some people report just feeling connected to everything around them in a way that they never have before. It can also help be a reset or a restart. But the same can be said about microdosing as people feel like it can help them get unstuck without them having to do these bigger, deeper journeys, and also without the time investment. Because like I said, microdosing is something that you can do like on a regular day, right? We work with a lot of people who have 9 to 5 jobs and they still microdose during the week. They're able to go be fully functioning versus like you can't take a macrodose and go to work. I mean, you could, but I wouldn't recommend it. But and antidepressants work similar to microdosing in the way like, they both can help with depression, but they're very different. So before, microdosing is 3 to 4 days a week versus an antidepressant that has to be taken every day. It's on a set schedule. For some antidepressants, I know for me at Fexer, when I was on that, if I wasn't taking it at the same time every day, then I was going to start feeling withdrawal. That's not the case with microdosing. Usually when you're doing antidepressant, it takes 4 to 6 weeks until you get to therapeutic dose in the system of it building up, where some people will feel the effects of microdosing within the first couple of doses. It really depends on where that therapeutic sweet spot is and how big that dose is. The research that I had looked at last year, I think it was looking at microdosing, and it was talking about how people were reporting that 3 to 4 weeks is really where they really started noticing some of the changes. It's not uncommon when we're supporting people for them to say like, man, I think maybe I'm experiencing something, but it very well could be placebo. And it's just like, okay, well, let's keep going with it and let's see. And then over time, they're like, okay, this is definitely not placebo. X, Y, and Z is happening. With antidepressants, oftentimes people don't do therapy or therapy is limited. It's not uncommon to go to a provider and they just start you on the antidepressant and they don't encourage therapy. But with microdosing, doing some sort of therapy or integration really can help the effects be more sustaining, because when your mind is quieter and you are able to create these new thought processes or let go of different beliefs, then you're able to actually change your mind. Michael Pollan did a whole book over it. There's I think a Netflix series called How to Change Your Mind. And what we're doing is seeing that it's helping people rewire their brain. So these new behaviors, patterns, thought processes actually become sustaining even when people are not microdosing. And that is not something that happens with an antidepressant. Oftentimes people say that they feel really numb, or just removed, like they feel like a shell, or they can't feel emotions whenever they're on antidepressants. I, for one, was one of those people towards the end where I just like got tired of, I couldn't cry. I couldn't feel anything except for anger, and frustration and anxiety when I was on antidepressants. And it's like, well, this is kind of like not where I want to be either. But with microdosing, it does not blunt emotions. If anything, if you're taking a higher dose, it can heighten them, right? So you still have the capacity to feel, but since the mind is quieter, you also have a greater window of capacity or tolerance to work through those emotions so that you can start building up that safety and, like I said, the resilience in it so that they aren't so big and overwhelming in the future. With antidepressants, it's not increasing your neuroplasticity. Microdosing is. And neuroplasticity essentially is talking about the moldability of your brain, your ability to create new neuronal pathways, new thought processes, new behavior traits. It becomes easier when we microdose because it increases that neuroplasticity and the ability to change things that can sometimes be hardwired. Antidepressants enhance your own serotonin and prevent the reuptake of it. Microdosing is a supplement. Psilocin looks like serotonin, like molecularly in the bodies. And that's why it's like the same key that fits into the same lock, right? So it's not actually increasing your serotonin. It just is a supplement. It looks like serotonin in the body. Ooh, went too far. Go back one more. How can microdosing help in everyday life? It helps quiet the brain. It can help quiet some of that negative self-talk, or, what some people have said is that that negative self-talk will come online, but then there's this other voice that comes on that's like, is that really true? So it helps quiet that, or at least gives you the availability to kind of reframe those thought processes. It can increase mental clarity and focus. It can improve mood. It can decrease anxiety. We've seen some people that it's able to help decrease their pain. This is often what I've seen is with like neurological type pains or fibromyalgia type pains. It can also decrease the anxiety related to having the intense pain, increase creativity and confidence, enables boundary settings because, again, the brain is quieter. People feel more confident, so they're able to share and show up authentically versus showing up masked as maybe the people pleaser or whatever it may be. And also it helps create a deeper connection with friends and family, because when your brain is quieter and you feel more grounded, then it's easier to connect with the people around you and just feel happy and grounded in that. It can also help increase creativity. We've had people come that like really is just for the creativity and seen some really beautiful things happen with that. Having a guide can be really supportive in finding the right dose and the frequency or the regimen of how you're taking it, because not every dose is, the same for each person. And that's kind of the nuance of it. And neither is the frequency of it. And this is the same thing that can be seen with cannabis. So it's always start low, go slow, and slowly increase it. There is a possibility of having some medication interactions, some safety considerations to take into account as well, and having someone to work with to kind of know where those are at and how to navigate it can be really supportive. Having a guide can also help with setting intentions and looking at what your intention is versus your expectations, because this isn't a magic pill. Like, I think there's magic in the mushrooms, right? But this isn't just a happy pill. It's not just going to come in and like, oh my God, like it's something that happens over time, and knowing the direction that you're going with a set intention really does help versus having this expected outcome. Also helping with avoiding habituation or tolerance. Again, like as far as it goes with addiction and things like that, and people being like, oh my God, I can't do it without my microdose. That is not something that I've seen in the past 4 years of supporting people. Now, would people prefer to maybe have a microdose before doing certain things? Yeah, but it doesn't mean that they're not able to tolerate things. Like I had a client recently that just went on a trip, and she didn't bring any cannabis with her outside of some gummies. She has really high anxiety, CPTSD, and she was so proud of herself because she was able to take this trip and be gone with her family for a few days. And she didn't have the microdoses. She didn't have the flower that she normally uses. And she said that she felt very like grounded the whole time and tolerated it really well. So this increases your capacity to navigate life when it can sometimes be challenging. Also working with someone who understands like the mind, body, spirit aspect of things, looking at how to support the body with supplementation, nutrition, lifestyle modification, All of those things are foundational and are good things to integrate and to incorporate into your microdosing experience. And having a guide really can help customize, like, what are your goals and what can we do to kind of shift and get you there. Connection and community, having people to talk to that are like-minded, and then also helping with the integration support of it, talking about it, going over it again, can just really change the experience overall. Microdosing without a guide is like entering a dense forest without a map. Sure, you might find some magic, or you might wander in a circle for days. A guide gives you the compass and helps you find your path. And that's what I tell people. It's like, this is your adventure. I'm just the Sherpa. I know the lay of the land, but if you decide you want to take a machete and go off into the woods, off the trail, like, I'm happy to follow you there too. But I'm just the guide to bring you there. So what is integration? Integration is something that we really talk to people a lot about, and it's something different that we have in our containers versus some of the other microdosing coaches or containers that are really focused on like dose and frequency. We really do help people from a therapeutic aspect so that you can get the most out of your experience. Integration is where we're using this as a tool, right? We're not using it as something that's going to come in and be a quick fix, or something that is just going to change the world, or something that we're just going to use as a crutch to get through. Integration is bringing that in a different way. It's implementing the changes that you want to make in your life. One of the things that I had heard previously, which I thought was great, is integration is when we take things that we receive in altered states and we create altered traits on the other side. Using it with intention, but not with expectations. The etymology of the word integration originates from the Latin word integrare, meaning to make whole or begin again. And to make whole is to bring some of those parts back online that maybe we have lost along the way from life and all of the experiences that can happen. Working with psychedelics can highlight the chaos and rigidity in both the internal and external reality, and integration enables the individual to be able to flow in the rigidity and chaos of life without being swept up in it. And integration is the tool that helps us from being swept up in life. And that's what I tell people is, like, you're going to go through things and you may have an experience that you see that you wish you would have done differently, but life is not linear. We're going to come back around again. And this next time you get the opportunity to do things differently. And then we go over it again. And then we're still instilling that, like, how we're doing it differently. And it becomes just second nature instead of something we're having to think about. And that's when we are really integrating the process. Like says, integration is a process. I say it's a process really without a goal, because when we integrate, we'll integrate one thing and then something else is available for us to integrate so that we can bring that back on whole online and back into our full authentic expression. It is the work that occurs before, during, and after a psychedelic experience. A lot of times integration is like, oh, well, what are you going to do on the other side? And when we work with people, integration starts beforehand. We want to know where we're going. We don't have to know how we're going to get there, but we kind of want to know where we're going and what the trajectory is and how we can support ourselves in the process before we get on the other side of the process, so that we can actually set ourselves up for success. Examples of integration is journaling, reflecting, meditating, movement and exercise, working with a therapist or coach, so that you can kind of understand, work through some of the things that are coming up. Gratitude practices, hydration, nutrition, spending time in nature, slowing down, spending time with loved ones, nervous system regulation, and having different tools to help with stress resilience, or different types of ways of integrating. So some of the unexpected things that we have seen, one of the things that all of these have just been kind of really interesting to see over time, because again, like, research is really limited on what is possible with all of these. We'll answer questions at the end. But it's been really interesting. So seeing people come in with long COVID and then they start feeling better, the chronic fatigue is going down, whatever it may be, the mood is shifting and getting more elevated. They're feeling more motivated, coming like lifting the fog that long COVID has produced for a lot of people. Women with PMS or people with uteruses that have PMDD and PMS, and then seeing where they're not so agitated or frustrated or having all of these things that come up around the time before or during their cycle. Chronic pain, seeing that with like people who have spinal cord injuries, like I said, fibromyalgia. We talked to some people back in May who do spinal cord rehabilitation, and some of the people within the therapy that they provide, the people who are microdosing, there's objective data that shows more nerve conductivity in the legs, and they're having more progress in therapy with those that are microdosing. We've seen people with TBIs that the nausea starts decreasing or the brain fog starts going away, the headaches start decreasing. There's been some people who report an increased sex drive. People with dementia, we've supported several people with dementia, and when it comes to that, it's not necessarily making it where people are remembering again per se, but it's helping people lift the depression. And dementia can be a very isolating disease where, you know, everything is foreign and all of this stuff. And when we see people who are microdosing, they become more engaging and with their family, more willingness to get out and leave the house versus just this isolated state. And also decreased desire for alcohol, cannabis, and other substances. This is something that is actually really common, whether people are trying to or not. Oftentimes people will decrease their alcohol use or the amount of cannabis that they're using. We've had people who, with support, have been able to quit smoking nicotine, and things like that. And there's also research on it. Of course, macrodose experiences are showing that there's a decrease or resolution around alcohol addiction, as well as tobacco use. So some risk and considerations before thinking about doing psychedelics. History of schizophrenia, right now, like a lot of things are showing that it's just not a good idea to combine psychedelics with it because of the possibility of there being increased psychosis. If there is a psychotic break that's happened in the past, there really needs to be a deeper discussion around it. Bipolar is something that I think is starting to get researched, but for a really long time, people who had bipolar or any type of borderline personality were left out of research because of the possibility of there being instability that happens on the other side or exacerbation of depression or mania. Again, like having a deeper discussion around stuff like that and seeing if it's appropriate is important. Same thing with pregnant or breastfeeding, just because there's a lot that we don't know. And we are working with things that are interacting with neurotransmitters. So those are things that need to be taken into consideration. Certain meds need to be looked at and evaluated. Antidepressants, some antidepressants can not interact, but there is a competition that'll happen at the receptor site, and which will blunt the effects of the psilocybin. And one of the things that I tell people is, like, if you imagine a dock, like a port where boats go into dock, and if your antidepressant is taking up most of that dock space, there's not going to be a whole lot of room for psilocybin to come in and hook into those places. So sometimes it takes a little bit of a higher dose in order to get people to have the experience. Now, that doesn't mean that if someone is on, 3, 4 different types of mental health meds, that we're just going to dose until we can feel an effect, because that is going to increase the risk of serotonin syndrome. Now, when we're working with like 1 or 2 antidepressants or something like that, it's a much different conversation, but there are things that we have to take into consideration. We don't want to just keep blasting the system in hopes that eventually we're going to get an effect, because that's not always the case. And this is one of the reasons why Ben Malcolm, who is a psychedelic psychedelic pharmacist who I've also done training with, talks about people who are on antidepressants, especially when they're wanting to do larger doses. It's definitely not safe to tell someone to come off their antidepressants for that. And also, like, you might be able to do it together, but it will dampen the effects. So don't put all your eggs in one basket expecting one type of experience when you might be handed another. And that's again why intention is really important. GABA analogs can have interactions, like she was saying, things like trazodone, even Klonopin, and some other things can kind of just like very much so interrupt the experience or block it. Which it doesn't mean that you can't use it. It's just something to take into consideration. But I have seen people who are on things like Xanax or Valium, things like that, that over time, when they're microdosing, they actually need those medicines less and aren't taking them as frequently. Blood pressure is something to take into consideration. Psilocybin is a vasoconstrictor, so it can increase blood pressure. What is seen in research for macrodose experiences is this intermittent kind of blood pressure elevation that will come and go that eventually stops after the experience is over. What I have seen with people who are microdosing is that at times there can be an elevation in blood pressure. Oftentimes there is a resolution, but again, like if someone is on 2, 3 blood pressure medicines, is it really a good idea to microdose? Mood stabilizers, again, something to kind of talk about. And also something, I will talk about medical history, but high blood pressure, like I said, liver and kidney disease, cardiovascular disease, seizures, all things are that we need to talk about and make sure that of the appropriateness. Also, people who have blood clotting disorders or history of a stroke, I would say needs further evaluation because there is research that psilocybin can thicken the blood. So is it appropriate? And we got to look at that. Recent hospitalization, spiritual crisis, spiritual emergency, any type of suicidal ideations or anything like that, this would not be appropriate. There's other things that can be talked about, but it wouldn't be appropriate for this just because of the way that this is not emotionally blunting. It can be emotionally sensitive for some people. And do we really want to make someone take someone there? And the inability to self-titrate, which means the inability to increase the dose on your own and be able to navigate what that kind of looks like, then this might not be a good idea because this really is an autonomous process. Like, yes, you have a coach to ask questions to and stuff like that, or a guide, but are you going to be able to do that on your own and in your home? So just some things to think about. And to work with us, we do free 20-minute discovery calls. You would talk to myself or Lacey, and we would give you the lowdown on the programs that we offer and talk to you about whether it's appropriate or not, if it's a good fit. And if it's not, we are well resourced and we can talk about some other things. And just because it's not a good idea right now or not appropriate right now doesn't mean that it might not be in the future. It's just we really need to check in and make sure that it's a good call. Onboarding calls, follow-up calls, and integration. We do group integration calls once a month for all of our current clients. That is free. And we also do macro dose facilitation. All right. And this is how you can follow us. We have a bunch of different platforms. Megan is always putting out some really stellar education on things. So I would, definitely invite y'all to check that out.
Yeah. Before we end the recording, I just would like to say that, like, with the recent crisis, I think that I really like to use this analogy that, like, if your life is like a vase, and something happens where that vase shatters, the time to start microdosing is not when the pieces are still up in the air. Say you have a loved one who passed away. The time to start microdosing is not when you are still like planning the memorial service and like, cleaning out the closet. That is not the time. The time is when the pieces have settled and you're ready to start putting them back together in a meaningful way. So when you come on the other side of that traumatic event and you're ready to start putting everything back together slightly differently, that is the time to start considering psychedelics.
All right. Thank you all so much for listening to this presentation. Y'all have any questions? We're going to get to questions, but for the people who are watching this later, if you have any questions, please feel free to reach out, send us an email. We are happy to support in whatever ways feel good.
Thank you for watching.